Ko ka tiritiri moana te monga, ko waimakarere te awa, no autatahi ahau, ke kai kohi kohi ti kainga in Nainei, ko Joanne Hona toku ingoa. Tēnā koutou, tēnā tātou katoa. Good morning. My name is Jo, and I'm from the beautiful far north. So I've come down from Kaikohi, and that's where I am based doing my PhD. I feel really privileged to be down here and presenting on my research today. The oranga and well-being of tamariki is really important to me. It's one of my definite passions. And my presentation this morning will focus on what the literature says about using animal-assisted treatments with children who have been maltreated or exposed to trauma. There is evidence to suggest that animal-assisted treatments enhances therapy with other child populations, such as those on the ASD spectrum and those going through paediatric medical procedures. This review doesn't focus on those populations though. I don't know how to use that. Sorry, I don't know how to use the fancy clicker. So my systematic review, the overall aim was on evaluating the existing research on the inclusion of animal-assisted therapy with maltreated children and whether or not it reduced their trauma symptomology. The three aims of the systematic review were to review the application of animal-assisted therapy with kiri, specifically how animal-assisted therapy with dogs is applied in treatments, to identify the methodology used, and including the dogs, and to review the effectiveness of animal-assisted therapy with maltreated children. So I just want to make the distinction between application and methodology. So for me, the application refers to how the dogs are included. You know, did they sit in a room, or were they actually involved in the treatment plan for the tamariki? And methodology for me means the theoretical approach employed. So was it trauma-focused CBT or EMDR? So with those aims in mind, the search strategy that was applied used the PICO tool and search terms that included animal-assisted interventions, animal-assisted therapy, pet therapy, maltreatment, neglect, adolescence, trauma. Yeah. So the inclusion criteria that we used, the study had to report on animal-assisted therapy or animal-assisted intervention, not animal-assisted activity or animal-assisted education, or be about pet therapy. The animal involved had to be a canine or a kiri, and it couldn't be a systematic literature review or a meta-analysis or even a description of what animal-assisted therapy was. It needed to be published in an academic peer-reviewed English language journal. The population needed to be children or adolescents who had been maltreated, and it needed to include a control or comparison group. So using the PRISMA statement for systematic reviews, after selection I ended up with 12 studies in my final review, and the 12 studies were critically appraised using the quality assessment tool for studies with diverse designs. So of those 12 studies, 3 were quantitative, 1 was mixed methods, and the remainder were qualitative in nature. So for those 12 studies, the sample characteristics, 11 of those studies actually fit within the age range parameters of the selection criteria. The one that did not fit within the age range was actually a study about families and whether or not children were going to be removed from their family due to maltreatment. So those children were aged 1 to 17 years, but the mean age for those children was 6 years old, so that fit within the age range criteria. Interestingly enough, of the 12 studies, only 5 of them actually had exclusion criteria of whether or not the young people had fears, phobias or allergies to animals, which I found really interesting. So all of the studies had small sample sizes, so roughly about 50 that was then spread between the control and the experimental group, but only 4 of the 12 studies actually had random assignment to the different groups. So 4 of the studies focused on child sex abuse. but a further 2 also had the main reason for maltreatment being sexual abuse as well. And there was only 3 settings across the 12 studies, so 6 of the studies were in child advocacy centres or community-based centres, 3 of them were in residential treatment centres, and 3 of them were in educational settings. Of the 12 studies, 4 of them used psychometrics that had a single reference point only, so they got information from the child only in terms of doing the pre and post testing, because most of the studies were repeated measures. And only 1 of the 12 studies actually triangulated information across 3 different, got feedback from 3 different people, like the child, the teacher and the caregiver. And the remaining studies actually only got information from 2 kind of different entities. Sorry, brain's not working. So they only got information back from either the child and the caregiver or the teacher, which again I found really interesting. Yeah. So of the 12 studies, the outcomes that they had, only 1 of the studies actually looked at the impact of being a therapy dog on the dog. And what that study found was that the selective attention of the dog decreased as the study went on, and that study actually went for 12 months, and that's the longest of the studies. 8 of the studies were 12 weeks in length, and the remaining 3 were kind of like one-offs because they were forensic interviews for allegations of child sex abuse. So again, I found that really interesting. Only 2 of the studies actually achieved their objectives. So going through all 12 studies, they all had massive objectives, obviously, because everybody wants to prove that, you know, working with a dog works. But only 2 of them actually achieved their full objectives. And all of the studies had statistically significant differences, but they were really minor statistical differences in terms of, like, for example, one of the forensic interview cases, they wanted to look at whether or not having a dog present in the room when you gave a feedback or you know, you talked about your sexual abuse, they wanted to know whether or not having a dog present would actually decrease your physiological symptoms of stress, so blood pressure, heart rate, and cortisol. What they actually found in that particular study was that the only statistical difference was in heart rate, and that dropped in the animal-assisted intervention group compared to the control group. But there were no other statistical differences in terms of the other stress responses that they were looking at. So the challenges for these studies is that many of them have low sample numbers. There's no manualised treatment in terms of how you actually include the dog in the treatment. Sometimes the dog's just there and sometimes you're actually training it. There's a lack of information in the studies about the type of dog, so the breed, the age, how the dog was actually trained to be a therapy dog. And there are inconsistent outcomes. So one of the studies actually talks about using trauma-focused CBT and including an animal, and they actually found that the control group had better outcomes than the group where the dog was included. Only 2 of the studies actually had manualised treatment models around how to actually utilise the kuri. So, quick recap. The aims of my review were to identify the methodology used to include the dogs, to review the application of animal-assisted therapy with the kuri, and to review the effectiveness of animal-assisted therapy with kuri and maltreated children. So in terms of the treatment modalities, only 6 of the 12 studies actually made specific reference to the type of therapeutic approach that they had. This is important because animal-assisted therapy is not a standalone therapy. It's supposed to be used in conjunction with EMDR, trauma-focused CBT, play therapy. Including the dog and how the dog was actually included in sessions in those 12 studies wasn't mentioned at all. In fact, only 4 of the studies had specific plans with how the dog was included in the treatment, and that was basically training the dog. So training the dog to sit, stay, and do that kind of thing, as opposed to actually including them in the treatment plan. Only 4 of the studies were individualised, where they actually had one-to-one attention with the dog. Another 3 of the studies were group sessions, so the young person never actually had one-to-one attention with the dog. It was shared between 4 to 6 of them. And then some of the studies were actually a mixture of both individual and group. So they got to spend one-on-one time sometimes, but not all the time with the dog. And that final aim of reviewing the effectiveness of animal-assisted therapy with kuri and maltreated children, the review did notice gaps in the literature. So while it's growing, the animal-assisted therapeutic intervention research is still in its infancy. So it lacks large numbers of quality studies. The studies that were included in this review also displayed low methodological rigour, and the majority of the studies utilised repeat measures of psychometric measures, so they can be quite subjective in terms of how you're feeling on the day you complete them. Challenges do include inconsistency in terminology, so it makes it really hard to compare studies internationally if everybody's using different language. There was a study released earlier this year, though, that does suggest using cohesive terminology so that we can compare studies internationally. There is a limited description of the therapeutic modality used, and again, as I mentioned, that is really important because animal-assisted therapy is not a standalone therapy on its own. Few studies actually detail how the kuri is included. Few studies actually say, this is what the dog did, this is how they did it. So that makes replication extremely hard. There is a lack of manualised treatment models, so again that makes replication extremely difficult because how do I know that I'm comparing my treatment with what you did? So in conclusion, the review found the evidence is inconsistent regarding whether or not animal-assisted therapy in interventions with maltreated children actually does reduce trauma symptomology. So I like to finish with this slide because I really love this quote, and yes, that's my dog that comes to work with me. She is a princess and her name is Princess.